and welcome to Wimpole Street Dental Clinic. My name is Chris Schimel, and in the small video which we're about to show you, we want to show you which techniques you have for oral hygiene or dental hygiene. So for your home care, we show you exactly how to brush your teeth, which materials you can use. We show you the theory behind mouthwashes and other utensils you can employ to clean your teeth, interdental brushes, floss and so on, and which age is best for what material and for which technique. So we really hope you enjoy the video, and of course our dental hygienist Jennifer Boardman is always here as well to help you with further advice if needed. So thank you very much for your time, and we do hope you enjoy the video.
Yeah, might be boring, but theory is the foundation of a lot of things. So first of all, we have to talk about the theory of how to brush teeth, which things to use, which things have which impacts. So we're going to do that in this part. Whenever we have patients visiting us, actually they really try their best to brush the teeth properly, have a variety of things. There's actually a picture of one of our patients in our practice with severe gum disease, and it's not about that the patient was lazy, but she used the products in a completely wrong manner, and she had everything there. So it is important that you have a concept of exactly how to brush your teeth. And the theory of that we're trying to show you with this series, part 1 theory and 2 to 5, exactly how we do it practically. So very important with dental hygienists, you have to find suitable oral hygiene aids and practice with them the correct application. And if you're unsure about anything, please bring them to your dentist and let them show you how these things are used. No? And it's very important. I know you've done oral hygiene probably a long time already, and you thought you've done it right, and of course it's then very distressing to find out that you maybe have done it wrong for a long time. And so please accept instructions from your dentist / from your dental hygienist, as they're really only trying to help you keeping your teeth, basically. Big thanks goes here to the Curriculum Prosthodontics from 2011, as the authors are written down in this slide. Great thanks goes to them, because this is actually the Bible for every prosthodontist, and they've done a fantastic job and bringing structure to the oral hygiene as well. So a lot of this in this lecture is based on this book. We start with what most people still use, with the hand toothbrush. So when you have one, you should be sure that it has a short head, length approximately 20, maximum 30 millimeters, that they have round bristle ends and round plastic bristles, multi-row brushing, that they are narrow tufted, that they have a plain bristle field, no V, so whatever you see in advertisement is not necessarily correct, that they have a handy brush handle, and please don't buy too hard toothbrushes, too hard bristles, as they might damage your gums. And please store your toothbrush clean and dry, okay? And don't use it for half a year or even 2 years. The optimal duration for a hand toothbrush is 6 to 8 weeks, and then you should change the toothbrush. With electrical toothbrushes coming to the market, a great change actually happened, and we want to, with this presentation, want to make sure as well that there is a myth discredited. Of course, electrical toothbrushes are way more efficient than hand brushes, and you can see the evidence is from 1963 and 1993, just a few studies in this aspect, but you see the evidence is quite old already. So electrical toothbrush is always more efficient than your manual toothbrush. Okay, so whenever you have the chance to buy electric, buy electric. Toothpaste, just quickly, there's of course a variety, just a few examples. Of course, there are way more toothpaste than this. Toothpaste consists of cleaning particles, the so-called abrasive, like calcium carbonate, silicium dioxide, binder, surfactants, humectants, preservatives, added flavors, dyes and color pigments, water, and prophylactic and medicinal additives, for example, like fluorides. Of course, in biological age, we have other toothpastes as well, not containing preservatives and so on and so on. That's of course up to you which one you want to use. I just give you a few basic facts which you should be aware of. The cleaning effect is based on the cleaning agent and the surface active substances. And you should desperately avoid highly abrasive toothpaste. So whenever you take the toothpaste between your fingers, it should feel like cream. If you feel the abrasive particles in between your fingers, the toothpaste is very likely too abrasive. And please stay away from whitening toothpaste, as they might damage your enamel. And once you've brushed your teeth, please just rinse briefly with water so that the fluoride in the toothpaste can act and strengthen your enamel. So with the technique, here's a quite old picture. The bristles should touch the tooth and the gums in a roughly 45-degree angle, and you should have small movements, so don't go back and forth in big movements with your toothbrush, just small movements, and stay with each 2 to 3 seconds, whether it's a manual toothbrush or an electrical toothbrush. With the manual or the electric toothbrush, you only clean about 60% of your tooth surfaces. So that means if you only brush with a hand brush or electrical brush, 40% of your teeth surfaces remain uncleaned. So that's where we always advise additional dental hygiene products to be used for interdental spaces. So that's absolutely vital. This is where the gum disease starts. This is where the decay starts. So this space, this 40%, is vital if you want to have clean and teeth and really keep them for a very long time. And which dental hygiene aids to use depends on the existing state of the dentition, on which sort of teeth you have, but generally floss and interdental brushes in combination or alone are advisable. Mouthwash, big topic. Make sure that with the mouthwash, actually that's not correct in this instance here, this is for an oral rinse under pressure, like Waterpik and all these companies coming out with irrigation systems. So it is okay to use them, but you have to be aware that the plaque is not removed, and it can be used if you have fixed orthodontic appliances, if you, for example, had orthodontic surgery, if you broke your jaw, if you can't move your jaws, and for All-on-4 or any fixed implant bridges. And of course, be careful if the water pressure is too high. When you have gum disease, be careful, because you might actually damage your gums and cause further problems if water comes in between the gums and the bone. Mouthwash, now I'm right. Mouthwash, there's a big variety. This is just a few examples of what exists. Here in the UK, most of it is Corsodyl, because there's a variety of others. Most important thing, make sure that they don't contain alcohol, and mouthwash is something you can use, but actually you don't have to. I haven't used mouthwash in 20 years, so normally toothbrush, manual or electric, and interdental hygiene is completely sufficient to stop decay and periodontal diseases. I just quickly show you what Corsodyl is, CHX, which is the abbreviation for that. Corsodyl is only indicated to use for temporary use, and you can use it before and after surgical procedures, or if you have limited oral hygiene for a limited time, if you have acute gum diseases and acute periodontitis. You can use a permanent if you're disabled, if you have permanently sick elderly patients, and for patients with limited salivation, for example, after cancer therapy, or with autoimmune disease, for example, Sjögren's syndrome. If you use it permanently, please talk to your dentist and to your pharmacy. There are different Corsodyl mouthwashes without too many additives and with a lower concentration. So you actually can use it permanently without the adverse effects, which we'll show now. Because if you use it, if you rinse it 2 to 3 times daily for approximately 30 to 45 seconds, you have the side effects of taste irritations, and you have irreversible brown discoloration of the tongue and the teeth. But this will subside. As you see above, the consultation always works for 7 hours. So use it more than 2 to 3 times a day will not be working very well. It's not needed. It's very aggressive. So please refrain from using it more than 3 times daily. Yeah, we come to the end. This is the basic theory. So what to take away? Best is electrical toothbrush. Then use interdental products when you're young, between 10 and 30, and you have a lot of gums. Use floss. And as you get older, you can start using interdental brushes as well. And of course, you can use combinations, and make sure at least once a day the teeth are really, really properly cleaned. Yeah, thank you for watching, and hope you tune in for parts 2 to 5, which will show you how to clean bridges, implants, removable dentures, and so on and so forth. And the second part of our series will show you exactly how to brush the normal dentition without crowns and bridges. So thank you for watching, and hopefully see you soon.